Hi, and welcome to the Functional Relations Podcast. I am Zachary Bird.
And I'm Caleb Davis.
Why is it taking 3 seconds to Are you not hearing me in real time?
Sorry, no, I was not paying attention.
Okay. Welcome to the Functional Relations Podcast, where we set aside time to have engaging conversation on relevant topics related to behavior analysis. I'm Zachary Bird.
And I'm Caleb Davis.
Did you like that radio voice?
Yeah, it was pretty good.
Oh, thanks. I've been practicing. This is episode 2 after all. Our topic today is about functional analysis because this is along our series on ethics for season 1.
Yeah, so how does functional analysis play into ethics?
Well, one thing is that some people might argue that it is unethical to use functional analysis because of some reasons that we'll outline, while other people might say it's unethical to not use functional analysis.
Okay.
So there are some reasons for that. And so what we'll outline today is reasons why functional analysis could be considered unethical versus when it could be considered ethical, and then try to find some common ground.
Okay. I like that plan. So when I look at this topic, something that pops into my mind is that in my experience, there's just been a lot of variation in what functional assessment looks like in my experience. So there's a number of different functional assessment methodologies that you can use, right? So you have indirect assessments. So it's like interviews, rating scales, things like, the QABF.
Right.
Then you have descriptive data, which would be most commonly ABC data. Like everybody in the field collects ABC data, whether, it's doing an actual formal FBA or, just on a day-to-day basis, maybe people are taking ABC data to kind of constantly be assessing and analyzing what's going on.
Right.
And
they want people to write a lot of stuff.
Right. And then you have functional analysis that looks at manipulating the environment to determine what is, wait for it, functionally related to problem behavior, or
look for some functional relations outside of the podcast.
Right. So you have these different methodologies, and you can kind of combine them or maybe even do them on their own, right? So maybe you could just do an indirect assessment, or maybe you do an indirect assessment and then also some observations, which I think is pretty common, and collect ABC data. Right. Or maybe you do just an interview and a functional analysis, or maybe you do observations and a functional analysis, or maybe you do interview, observations, and a functional analysis. And I've seen it all done. And so there doesn't really seem to me to be this standard process that everybody does when they're doing a functional assessment.
So I think there are some reasons why people don't use functional analysis as part of their FBAs or whatever. And that can probably be related to a number of things where they say it's too time consuming, or it's people feel like you're poking the bear or whatever. But we do actually have some data on how many people do use functional analysis as part of their, at least the folks maybe in Massachusetts or whatever.
Right. So there was the article that was published in JABA in 2015 that was by Roscoe, Phillips, Kelly, Farber, and Doobie. And they did a survey on functional assessment methods within the state of Massachusetts. And basically what they found was that a majority, or around 68% of practitioners, think that functional analysis provides the most information for selecting behavioral treatment. However, only about 35% of people typically use a functional analysis, and more commonly, so around 60% of people that responded to the survey said that they usually use descriptive assessments or descriptive in combination with indirect, which I think lines up with my experience, where indirect and descriptive data are often used to do a functional assessment and inform treatment, and less commonly functional analysis. So I wasn't really surprised by these.
Right. It's good to have those type of surveys, because then you kind of see what the state of the field is, or at least in the place that they were looking. So what do you use?
So
or what's your methodology or whatever?
Yeah, it depends. Oftentimes I kind of fall into the 60% that do some sort of indirect assessment and descriptive assessment. And if I get pretty clear outcomes with that, when I do a QABF, if it suggests a pretty clear function, and then when I do some observations, I see events that support that function, and it's pretty clear, and I can't really see like the possibility for multiple functions, even though that's always possible, right? But it seems unlikely.
Sure.
Then I will move to treatment based on that.
Okay.
However, I do also do functional analyses. So if the behavior that I'm assessing is, I would say, more severe, and I really want to make sure that I have a very clear function and that I'm as positive I can get about that function, given our current, all the methodologies out there, I'll do a functional analysis just to confirm it. Or if I do an indirect or descriptive assessment and there are multiple functions suggested and it's not clear, right? So if I get outcomes that say the behavior is maintained by escape, attention, tangible, and automatic reinforcement, I probably would consider doing a functional analysis.
Yeah.
So I fall into both camps, I think, where I just kind of look at the situation and I'll try to pick and choose which methods I think are going to give me the best practical chance of identifying the function so I can move to effective treatment.
Yeah. I think, we probably use very similar methodologies. We worked together a long time, and so I probably have nothing to add for when I choose to do an FA and when I don't. That does seem to be the kind of thing. And, one of the good things is it can be effortful to do functional analyses, but over the last several years, people have been doing a great job in the research areas of getting functional analyses that can be quick, convenient, and can kind of eliminate that as a barrier. So, so that's like a good thing for our field for sure.
Right. You have trial-based functional analysis. You have, synthesized functional analyses. You have latency functional analyses. All of these can actually just reduce the length of time.
Yeah. So if anybody's listening and it's a barrier for you because of effort or time, check out some research on those topics. We can actually leave them some in the notes. That would be good. And check out probably, like Hanley's paper in 2012 on myths and lore.
Yeah. So while we're talking about time and effort, right? Because I think that's historically been one of the barriers that's cited.
For sure.
Barriers it takes a lot of time to do this, and I think like you mentioned, as the methodologies have kind of evolved, people have created some methods that are much shorter and kind of address that. Personally, for me, a lot of the effort that I would kind of cite as a barrier is doing the things up front before you even do an FA, that it's so time consuming. So when you think about when you're doing a functional analysis, if you're if you're working with behavior that's possibly there's some risks associated with it, like aggression or self-injury, there's a whole process you have to go through to make sure that you're limiting risks within those sessions. Having criteria for termination, having possibly medical personnel involved, and
consent from all the parties.
Yeah, like so, talking with parents, getting approval, talking if you're in a school, maybe you have to talk to school administration and get approval. So all of that is actually quite effortful from what I've found. And when I actually get to the functional analysis, that's in some ways, the easy part, right? Because I
Yeah,
mean,
true.
for you and I who have training in conducting functional analysis and have a good amount of experience, I think, doing it in clinical settings, I feel like once I'm there and I've done all that stuff, it's like, great, this is great. We can get this done now. And it's like all that stuff up front that's almost the barrier.
Yeah, that's a good point. That's a good point.
So in some ways, like when I have like my problem solving decision making, that falls into it. So when I'm like, do I do descriptive or indirect versus functional analysis? I'm also taking into account the severity of the behavior, the results of other assessments. Do I need to go through this other process to, get an FA put through? Does that make sense?
Yeah, for sure. So I think it would be valuable for us to now focus on the ethics.
Yeah.
So some people would argue that it's unethical to use functional analysis. And do you think that that's legitimate?
I don't think so. If you do it the right way, it's ethical, right? Like there are certainly considerations that in some cases maybe doing a traditional functional analysis wouldn't be ethical, right? So if you're putting the client in more risk or if you're putting them at a greater risk than they would be in the natural environment, yeah, I think you have to consider the ethics on that one, right? So
Okay.
there are ethical implications about keeping people safe. And
so there could be situations where you might suggest it's unethical to use a functional analysis.
Possibly. I always say there's always a chance.
Sure. Yeah. And I agree with that. Yeah. I mean, I think safety is one of those concerns that people are often talking about. They're like, so the behavior is too dangerous. And it can be to themselves or other people. And someone would use, there's this like common example I feel like I've always heard. It's just like, if a student is going to gouge out their eye and they'll go blind, that's too dangerous or whatever. And
right. Which, I mean, there are methodologies that have been developed to try to address that barrier, right? So latency FAs, FAs on precursory behavior, like all those have been designed to help with that. But I mean, even then,
I would also argue what I'm saying is, I guess my point was, although those people exist because we've worked with people like that, it's a very small percentage of the population that we would be do functional analyses with, in which you have to worry about someone gouging out their eye. It's just like a small population.
Right.
So
right, for your everyday sort of like maybe aggressive behavior or property destruction, it's probably gonna be fine.
Yeah.
As long as you kind of follow like the best practice steps of like planning for it and making sure that like you're not putting somebody at additional risk or something, right?
Yep. And what are some other reasons why people might suggest? I mean, I think one thing that people might suggest is also unethical related to functional analysis is reinforcing behavior that wasn't already a problem. That's something people are
reinforcing behavior that wasn't a problem, or creating a new function of an existing type of behavior.
Yeah, right. So
like an existing topography that maybe is attention maintained, or no, maybe it's escape maintained, and now before it wasn't sensitive or maintained by attention, but for whatever reason it is now, because it's been exposed to like this like very very powerful contingency, or maybe tangible access to tangibles is provided contingent on this behavior. Before it wasn't part of like that operant class, and now it is. So that's like a common reason somebody might say you shouldn't.
Okay. So on the flip side, are there...
But I should note on that, if you look at what's recommended when doing a functional analysis, it's not recommended you include a tangible condition unless you have pretty good evidence that that's a potential function, right? So like if you're talking with a caregiver and they say, yeah, usually when this client's having disruptive behavior, I'll give them their iPad to calm them down. And then you do some observations and see that happen. it's probably you're not exposing the behavior to a new contingency. It's an existing contingency and you're just trying to test it, right?
Yeah.
In contrast to that never happening, and then you're like, here's your iPad for having problem behavior, and that's like a new thing.
Yeah, right. Yeah. I've heard Greg Hanley, like one time I think I was asking him about this exactly, and he was saying like, well, also if you're in this type of a situation where the iPad will reinforce like some problem behavior, then you should know this. Like this is a good thing to know anyway. So even if it wasn't a function before, but and you like taught it or whatever, it would also be really great to know how sensitive someone is for that thing to function as a reinforcer for any behavior that you just are delivering consequence for. So then I think that there could also be an argument made that like it's unethical to not use a functional analysis.
Okay.
So
right. So to me, that kind of ties into when thinking about ethics, the right to effective treatment. And it's been shown that functional analysis, I think, is more reliable at producing the function than maybe something like descriptive data, right?
Yeah.
So
I mean, I think
it's
considered like the gold standard, right? Functional analysis is the gold standard.
Right. So and descriptive data are sort of like notorious for producing you could get like a false positive, right? So like attention is in some form often follows different types of problem behavior. And that just might not be. So if you're collecting ABC data, you might say, looks like we have an attention function because most of the time problem behavior is followed by attention, and less frequently it's followed by access to preferred items or escape or things like that. But that just might not be the case, right? Like attention may be some sort of like neutral stimulus. It may not actually function as a reinforcer.
Right. And so someone could argue like, well, if you're going to give someone effective treatment or the best chance of an effective treatment, it would be unethical not to use the gold standard, which is functional analysis.
Right.
And so, yeah, I think that there are some considerations on both sides of this particular argument, although it probably has a lot to do with context, right? It has a lot to do with the particular situation you're in and making a decision about ethics related to that. Is that how you see it?
That's how I approach it.
Yeah.
Yeah. I think there's lots of factors. There's, the setting you're in, severity of behavior, maybe results of previous assessment methods that you're taking into consideration. And so I think that's reflected by the way I kind of choose, like I'll use each of those methodologies, how I kind of see like what makes most sense. But then you might have, and this is probably more common, where people don't maybe use the FA methodology at all.
Okay. Yeah.
But I think there are probably reasons for that, right?
Yeah.
There are definitely
barriers,
reasons,
right?
Right.
Okay. So I think what we should do then is go talk to some people who have a lot of experience in this area and see what they have to say.
Yeah, sounds good. Do we know what we're going to ask them based on what we just talked about?
So I would ask them something about, are there times that you feel that it is unethical to use functional analysis? And then are there times in which you feel that it's unethical to not use functional analysis? Okay. Are there any questions that you think would be valuable to ask?
I think the ones you bring up are good. I would also just be interested in asking more of a general question about, are there any factors outside of the assessment methodology itself that influence their decision on what to use? Okay. Because I kind of threw in my 2 cents about like kind of a process that I use, which isn't super straightforward. I think I try to take into account a bunch of different variables, but I would be interested to know what other people do as well.
Yeah. Okay. Great. Let's go ask them. welcome Dr. Kahng. Thanks for coming on the podcast.
Well, thanks for having me, guys.
Dr. SungWoo Kahng is a professor at Rutgers University in the Graduate School of Applied and Professional Psychology.
Today, we're talking about the topic of ethics and how it relates to functional analysis and the use of functional analysis. And the first question Zach and I came up with is, in our experience, there's a lot of variability in the methods people use when conducting a functional behavior assessment. In your opinion, is a functional analysis a necessary or an important part of every FBA that somebody conducts?
Well, so for me, just to kind of frame this all and give you an idea of like where I'm coming from, my background is obviously in the functional analysis of problem behaviors. So, although there are obviously several different types of functional assessments, the vast majority of my research as well as clinical work has really focused on that functional analysis part of the whole assessment there. And so, I guess, for me, I'm a bit biased in that, I see the value of functional analysis, whether it be through research as well as clinical practice and intervention. And so I'm of the opinion that, yes, functional analysis is a very important part and should be a regular part. Perhaps not necessarily in every case, but I would say in the vast majority of those cases, the functional analysis should be the go-to functional assessment.
Great. So I think Caleb and I have had similar feelings about this. We kind of have a similar process. Kind of when we started talking about it, we were thinking, we definitely think FA is an important piece of an FBA. But I think we were saying, like, once we do our interview, once we do our descriptive assessment, and we might do some sort of QABF or something like this, if it appears unclear to us, this is when we might be more likely to use a functional analysis. And if it seems very clear to us, even though we're aware of the research, how descriptive assessment can be misleading, we don't always use it, but we know it's an important piece. How does your process differ from that? Or how is it the same?
Well, I think like what you're describing is probably what I would imagine, what I hear a lot of folks do out in the community there or in practice, which is obviously a very reasonable approach. And there are concerns about I guess like lately or over the last couple of years, I've been giving presentations related to the use of functional analysis and I guess the reservations that people have about the use of functional analyses. And my point of one particular talk is always been, I guess there are beliefs as to why functional analyses aren't necessarily the best option. But are those beliefs truly based on evidence or data, or are these just kind of fictions that people have just kind of assumed over the years there? And my conclusion, basically from those talks is that the vast majority of those beliefs are really fiction, because there is no data that supports, like for example, the safety of functional analysis is like one of the biggest concerns, right? Especially someone who engages in self-injurious behavior, you might be putting them at greater risk for injury by providing these consequences for the actual occurrence of problem behaviors or SIB there. My rebuttal to that point is that, these are all individuals who already engage in these problem behaviors, who already are in environments that allow these behaviors to occur. And we actually published a study 4 years ago or something where we looked at the rate of injuries in functional analyses versus out of functional analyses. And what we found is that there's very little difference. And in fact, in general, there are very few injuries overall, which is very surprising given the severity of these behaviors. And so I think, kind of going back to your question about the whole process there is like, why aren't we doing that next step or that last step of doing the functional analysis there? You've spent the time to do the interviews, you spent the time to do direct observations. Why can't we finish that up by doing a more systematic approach to identifying the functions of the problem behavior, which is by doing that functional analysis, obviously there. And so, I would argue that we should be doing that because it's a very important part of that whole process, even if it's just simply validating the results of the descriptive assessment and the indirect assessment there. And Zach, as you mentioned earlier, like research shows that there's the correspondence between the outcomes of the indirect assessments like the QABF and the FAST and descriptive analyses as compared to functional analyses isn't always that great.
Yeah,
that's a great point. When thinking about the ethics of the functional analysis, is there a time where you can imagine a situation where it would be unethical to use a functional analysis?
I was trying to think of situations where it would be unethical. And I honestly, I have a difficult time. And again, this might be because of my bias towards conducting functional analysis, given my background and training. But I always tend to argue that it is unethical not to conduct the functional analysis because you're not doing state-of-the-art assessments. You're not providing by not doing the functional analysis, you're not providing the highest quality of care as we as behavior analysts should be doing there. Again, kind of going into those ethical questions that might be related to functional analyses. There's that safety issue. Well, again, is it or any less safe than what's actually going on? Again, kind of sticking to that point, I would also argue that sometimes you could probably argue that the functional analysis is actually a safer environment than what's happening in the outside of the real world there, if you will, right? So in the real world, it's very rare that someone might have a one-to-one with them, during the entire time there. Whereas in the functional analysis, there's at least one person directly observing, and in all likelihood, there's one or two people observing, and then a therapist in the room that would be available right then to intervene in the event that there's some risk of injury there. So
yeah, that's a great point.
Is one situation where functional analysis might actually be a safer, more ethical situation. You've got other examples or other variables. For example, in a functional analysis, right, we tend to provide consequences on a fixed ratio schedule, like FR1 schedule usually. Whereas in the real world, behaviors are very rarely reinforced on an FR1 schedule. They're typically reinforced on some intermittent schedule. And as we all know, especially from our textbook, intermittent schedules tend to have higher levels of behavior, tend to be longer lasting, and so the reinforcement schedule in the real world tends to be more problematic than what might be happening in the functional analysis environment there.
Hey, sorry to interrupt, but if you're a BCBA and interested in getting ethics CEs for listening to this episode, you can purchase them at functionalrelationspodcast.com. Each episode is worth 2 CEs, and you'll need to provide 3 code words when you go to check out. The first code word for this episode is bucket. Bucket, like there's a hole in my bucket. BUCKET, bucket.
One thing I guess this makes me think of is, so you said you would think of it being more of, it might be unethical to not do a functional analysis. Can you think of an example in clinical practice where you may forego the functional analysis if you had really straightforward results from other methods?
I think for me, maybe perhaps one limiting factor might be time. So if I had a really, really, really short period of time to do an quick assessment, do a quick treatment evaluation, then I might forego a functional analysis. But I think one of the beauties of all the functional analysis research, particularly nowadays, is it seems like a lot of the research on FAs has really been kind of geared towards making it more efficient. Right, so you've got things like the trial-based FA that Sarah Bloom has obviously talked a lot about. You've got the ISCA, which I think one of the main advantages of that is that it is really it's very, very quick. And so even if that question about efficiency and having the time to do that, perhaps with what's been happening lately in terms of research, that might not even be an issue either there.
So Caleb, he's telling us we should get on the functional analysis train a little more often.
Yeah, for sure.
So I think that's great advice for sure.
Yeah, and you think, I should probably copyright the functional analysis, and then that way you have to pay me royalties every time you guys have to use it or something like that.
I'm afraid you'd be a relatively poor man if you had patented it already. But after this podcast, you might see it start to roll in. Who knows?
That's right.
Yeah, so I think the points you've brought up so far are really well thought out, and we expected you to have well thought out answers when we invited you here. But one of the things that I've come across, I've worked in places that are well known for being places where there's high quality behavior analytic services, and I've worked in places in the field, and it's kind of like maybe it's an in-home agency, or maybe it's an agency that is working with schools or in a non-public school setting. And my experience is that a lot of people are interested in FAs. Like, they're intrigued when we talk about functional analysis. But it almost seems like it's people view it as if it's something for the ivory tower folk to do, and it's not for them, or that they haven't been trained in it, so they don't feel confident in just reading. And I think there's evidence to support if we are just to read protocol and then implement it, we won't do it very well. So I'm wondering if you have any maybe advice or thoughts about how to pull it out of the ivory tower and have people use it more often in the commonplace settings that we do a lot of our treatment in our field.
Yeah, no, I think that's a great point. And I see that and I hear that a lot. And, perhaps, this is a result of, all that research that's been out there on the functional analysis, because, the research are being done in exceptional places, whether they be university programs like the University of Florida, for example, or exceptional, schools like New England Center, or hospitals like Kennedy Krieger. So, I think that the main method of contacting functional analysis would be, like seeing the research, and the research is coming from exceptional places there with very highly skilled people. So that that can make, I can see how you get this kind of like ivory tower feeling, very, very intimidating there. If you think about it, there really is no functional analysis manual that's kind of like targeting the masses on how to do a functional analysis. A lot of the dissemination within our professional community is through the research that's being done out there. And so that doesn't, at least from a dissemination to the practitioners, that doesn't lend itself very well to disseminating and making it very user-friendly there. So, if any of your listeners are interested in developing a project, some type of a manual for conducting functional analysis would, I think, be really, really beneficial, and would really help to kind of get more people to actually do this there, though.
Yeah, that's a good idea.
Yeah, the other thing that I do notice, though, is that people in practice do use a functional analysis, and I've got to admit that I am somewhat pleasantly surprised when someone who does, let's say, in-home services will say, "Well, yeah, we did our functional analysis, and we found this happened," and I think that's wonderful, but how often that actually happens, it's questionable. And there was a study that Matt Norman and his colleagues did where they surveyed behavior analysts to get a better sense of what the actual practice of functional assessments was. And what they found was that, although the respondents, somewhere about 600 respondents, I think, although the respondents indicated that they felt that functional analyses were an important part of the whole assessment process, very few of them, about a third of them, indicated that they actually used it on a very regular basis there. Even though they received training, they reported they received training on it. They understood that functional analysis is a very important part of what we do. That didn't actually translate into practice there. And so I think there is that disconnect. I think in large part because of what you said, is that people kind of are intimidated by functional analyses there.
Yeah, I think that's right.
One thing that pops up, I think, is the training factor. So I've certainly come across people who maybe they're working in a setting where they don't necessarily have a lot of peers to help support them, and they may not have had an experience ever running a functional analysis. Can you think of, if you were encountering somebody who maybe didn't have experience, what sort of guidance you might give them if they were listening to this and were really interested in learning how to do a functional analysis?
Yeah, Caleb, that's a great question. And, I think a lot of our training, really occurs through the experience part, right? So, which is the case for a lot of the kind of helping professions there. So, we can talk about the functional analysis in the class, but in terms of actually learning how to do it, you've got to actually be there doing it there. And so, if you happen to work in a clinic or a school or some other type of a program where they provide that hands-on training, that's wonderful. But if you happen to be in a graduate program where the experience doesn't necessarily provide that opportunity to get that hands-on experience, that makes it much more difficult. And I guess obviously that's where you see a lot of that disconnect there. In terms of, how do you, like, if you don't have access to these experiences while you're in graduate school or your current job, how do you get more training? I think one of the best ways is to ask someone that you might know who's perhaps in an environment where they're doing functional analysis, and say, hey, can I come watch? Do you do functional analyses there? So in my professional career, I've been at a couple institutions. One was a hospital in Baltimore, and another one was a university in Missouri before I came to Rutgers. But in both places, whether it be at Kennedy Krieger, the hospital, or University of Missouri, where we also had an outpatient clinic, we had people frequently contacting us and say, hey, can we come by and watch how you guys doing functional analyses there? We've never really had opportunity to do this. And we've always been more than happy to say, let them in and provide, give them opportunities to observe. And if they wanted to spend more time, we were more than happy to do that as well. Give them actual hands-on experience depending on their availability and interest there. So I think, as a profession, generally behavior analysts are good about helping everyone else out. And so I think, if you can identify a place that has, good services that use functional analyses, ask them to spend some time and learn how to do it there.
Yeah, that's a great advice. I think that's exactly right. Everyone that I've come in contact with who uses functional analysis is very interested in talking about it and very interested in disseminating their knowledge. So I think you're right about that.
Are there any things that you would like to discuss, maybe that we haven't touched on, that you feel like is important to note about the ethics of functional analysis?
Yeah, this kind of goes back to me trying to make an argument that I consider it actually unethical not to do the functional analyses there.
Yeah,
and the reason I've been thinking about both kind of like those. The facts and fictions about functional analyses versus the ethics of conducting or not conducting functional analyses. It really is based on just kind of my experiences over the years. So whether it be any clinical experiences that I've had, just kind of interacting with people, particularly school personnel, school administrators, for example, it seems oftentimes are very opposed to functional analyses. But also talking to former students, who've they've graduated and they've gone on to some wonderful job somewhere, but they say, they really discourage the use of functional analyses for reason X, Y, and Z. And so it's always concerned me that again, people are making these assumptions about functional analyses, really without any basis there, but using those false assumptions to make their decisions about whether or not they should be doing functional analyses there. But then in terms of the ethics of this, if we go to the BACB's ethical code of conduct there are specific codes that we should be concerned about when we choose not to do a functional analysis, right? So, if we start with code 3.01, that's the behavior analytic assessments. And this is what I'm looking at my notes. I'm not some ethical code savant over here like that, right? I've got these right next to me here. But it says, as behavior analysts, we should be conducting assessments, right? So that could be functional assessment, some type of functional assessment there. But if we continue to apply the ethical codes to functional assessments and analyses, you've got 1.01, which is the first one, reliance on scientific knowledge. And the research that we have to date shows that the indirect assessments, those questionnaires like the QABF and the FAST, have really poor correspondence with functional analyses, so they're not very good about predicting the results of functional analyses. The same thing goes with descriptive analyses. There are studies that show that the correspondence is very poor. My colleagues, Bethany Contreras and Savannah Tate and I, are doing this quantitative review right now, looking at the research on descriptive analyses. And one of the questions that we're asking is, well, how, in terms of all the studies that have been published on descriptive analyses, how well do they correspond to the outcomes of the functional analyses? And we're finding that they don't correspond very well. It's somewhere about 50 to 60% agreement between those two there, right? So the data are suggesting that the correspondence is poor between these indirect assessments and these direct descriptive assessments compared to the functional analysis, which is our gold standard there. So the data suggests that perhaps these aren't the best, which would then a question where are we by using or relying upon indirect assessments and descriptive analyses, are we abiding by code 1.01, relying on scientific knowledge, and then also code 2.09, which is treatment intervention efficacy. Although that's related to treatment, the same question or the same standard should be held to assessments. Are we relying upon effective assessments as the basis for our treatment development there? And so, given what we know so far about indirect assessments and descriptive analyses and the lack of correspondence, I would question, relying solely upon those particular tools as the main method of identifying behavioral functions there.
Thank you. Yeah. So I have one question that I'm willing to cut out because we didn't give you any warning, although we didn't give you any warning on the last 5 questions. But I've been working with a lot of individuals who are adults and maybe a little bit higher functioning than a lot of folks who may be in the demographics that are published in the literature.
Mm-hmm.
And I didn't know if you had any advice about using functional analysis with higher functioning individuals, or if you've had experience with that population.
Yeah, no, Zach, that's a great question, great point. And I agree. I think, the perception is, and many of the studies that have used on functional analysis have focused on children, right? Or at least younger individuals, primarily with, autism or some related developmental disorder there. But there are a handful of studies that have kind of look outside of that there. So, studies have looked at using functional analyses with older adults with dementia, for example, there. Right, it still works and still very informative there. Studies have looked at functional analyses in the classroom with typically developing kids, or cute little preschoolers are typically developing preschoolers there. So there's a study that shows the application, or it applies to other populations there. And I think your question about higher functioning individuals, adults perhaps, is a very interesting one. I do some consulting and research with the Rutgers Center for Adult Autism Services here on campus, which is an employment-oriented or focused program for adults with autism. And generally, they don't have very many problem behaviors, but there is an individual who engages in more problematic behaviors. So we tried to do a trial-based functional analysis with them, and a couple of different variations. And no intellectual disability, so I guess he'd be classified as high functioning autism. And when we first started the functional analysis with him, it was a completely different type of an arrangement. The schedule was completely off. He was back at the center where normally he would be out in the environment and work. And one of his first questions that he asked, to the therapist was, "Are you studying me?"
Yeah.
And so he clearly knew that something was different and off about that.
Sure.
And so we had to make some modifications so that it was a more naturalistic type of a situation there. And so I think the point of that is that there is no one type of functional analysis.
Yeah, great point.
And so one of the things that I love about functional analysis is that it is so flexible. And as is the case with pretty much everything we do as behavior analysts, it's all individualized. not only to the client or the people that we're serving, but to the environment and the context that we're serving the people in there. So as with functional analysis, I think it's very, very flexible, very adaptable to those things. But the challenge is, and part of the reason why this is so intimidating, is to figure out how to make those adaptations and those variations to accommodate, whatever the situation, whether the person's high functioning, whether it's being done in a school and things like that. And I think that takes some training and some experience to do there.
Hi, Sarah. Welcome. Welcome to the Functional Relations Podcast.
Thank you for having me. I'm excited to be here.
Dr. Sarah Bloom is an associate professor at the University of South Florida.
The theme of today's episode is ethics related to functional analysis. So the first question we came up with was, there's obviously a bunch of different functional assessment methods. Do you think conducting a functional analysis is a necessary part of every FBA?
My answer to that question depends on what your definition of functional analysis is. So I would tend to define functional analysis perhaps more broadly than maybe some percentage of the field. And so because of that, my answer is, yeah, functional analysis should be part of every FBA. But given that answer, I have to say that a 8294 FA is not necessarily part of every FBA. There's so many adaptations, modifications, customizations that are possible. But yeah, I really do think that if you are doing those things, then there's no reason why it couldn't be part of every FBA.
How do you define FA, right? So you're saying maybe that you were defining a little bit different and maybe a little bit more loosely. So how would you
I'd say I'd define it more broadly. Basically, you should, in my opinion, make a wholehearted effort to know what the function of behavior is before you try to reduce it. And for me, knowing what the function is involves an FA, and an FA to me is an approach rather than a specific procedure. So what I mean by that is an approach to, it has to have the essential elements that are like codified, and firm, but then you make adjustments according to the context in which you're conducting it. And I mean that in the environmental context, the cultural context, the family context, the topography of the problem behavior is part of the context. What is known about the individual who's engaging in the problem behavior, all of those things are part of the context. So what you have to have is the essential element is prediction and control of behavior. You've got to be able to turn behavior off and on. And you do that by manipulating suspected environmental factors that are influencing behavior. And, you get that as narrowly figured out as you can. And you might have to make a lot of modifications to what was originally published in 1982 in order to do that ethically in every case.
That's good. So a functional analysis appears to me that you're identifying some functional relation, right? And so if you're identifying some functional relation, does it need to be experimental?
Yes, because the experimental component is what it gives you that prediction and control. If you don't have that piece in there, you have correlational relationships, but you don't have the ability to, and you might be lucky, but you don't have the ability to predict and control behavior. There's a paper by Hank Schlinger and Matt Normand in JABA on the origins and functions of the term functional analysis. And it's a really nice paper that grounds the term functional analysis into a more conceptually systematic framework that includes basic science and really all of our applied science, translational, whatever, in that it's a reminder that when you're demonstrating experimental control over something, you're conducting a functional analysis. So, that's what I mean when I say functional analysis is an approach, not a procedure, because it's the standard by which we consider all behavior analysis. Did you demonstrate experimental control? So I don't really know why we sort of get a pass on that with problem behavior. Well, I know I have some theories. But do you want to know why I'm so passionate about this topic?
I'd love to hear.
Yeah.
I'd love to hear that.
Okay, so once upon a time, I was in charge of a classroom, even though I was, I wasn't prepared by a high quality special education personnel prep program. In fact, I wasn't prepared for any sort of working with children beyond having been a camp counselor. But I was in a rural school district, and I had shown a willingness as a substitute teacher to learn everything I could. And I was working in a school for children with exceptional needs in Delaware, and it was a great school district. It was out in a beach town that's sort of real quiet in the wintertime, but they just had a high quality culture, very, very behaviorally oriented school, really, really nice work. And so when they saw that I was willing and I was there, they gave me a lot of on-the-job training. And I worked with them for a few years before graduate school. And the classroom that I found myself in before I left, I was in this particular classroom for about a year and a half as a long-term substitute. And it was a classroom of 4 little boys, all diagnosed with autism or on their way to being diagnosed with autism. And they had a lot of problem behavior. Like, we weren't allowed to have, there was one point where we weren't allowed to have recess with the rest of the school because I couldn't keep kids safe, So, talk about restricted environments. We got to have recess, but we had to have it at a different time of the day than the other children were out there. And it was really hard. It was really frustrating. And I was going home crying every night because I really fell in love with these kids, and I really could not figure out what would work, to address their problem behavior. They had a really nice PECS culture in the school. So the kids were making progress on goals. They were communicating wants and needs, but we just had this problem behavior that was also happening. I had no clue what to do. The school district hired, and people tried to come in and they made recommendations. And basically it was like we were edging further and further and further towards punishment. And it felt really wrong to me. And I think it felt wrong to everybody else around me too. And so they assigned this really fantastic school psychologist to work with me. I don't know if I have permission to say her name right now, so I better check before I do. But you're out there, Dr. B. and she had been to one of Brian Iwata's workshops on functional analysis. And so she brought me this article, the Java article, and I read it. And there was a blizzard, so I was stuck in my house for a few days. So I read it a few times,
You really got to know it. Yeah.
Came back to school ready to do this. And so I was like, okay, so I'm going to divide up my day into these, conditions. I'm going to collect data on I'm going to, respond to this particular child with these, potential consequences. And then I'm just going to tally how much problem behavior is happening. I mean, I was pretty, how do I say, ambitious. It was pretty ambitious what we were trying to do.
Yeah, for sure.
But I just didn't have access to a separate environment and I couldn't leave the rest of the kids, and everybody else needed stuff all the time. It was a real busy classroom. Kids are, running around with sentence strips. They're like, I want cookies, I mean, it was, it was a good time. And I was trying to not respond to problem behavior, for our ignore condition,
Yeah.
But I had to keep my eyes on him a little bit. And he would it was whenever I would like just cheat my eyes over like out of the corner of my head to like just make sure he wasn't about to like fall off something giant, or hit somebody over the head with a chair or whatever, he would like, blah, ha, ha, ha. He just thought that was like hilarious.
Yeah.
Well, I don't know what he thought, but he laughed a lot. And I was like, okay, so we got to figure out something to do so we can keep an eye on him, but he's not getting attention from our faces, So I came up with this idea that we were going to get these paper bags and cut out holes for the eyes. Right. So I'm walking around in my classroom with a paper bag on my head. And the principal comes in and looks at me and he's like, all right, so what did you need again? You need like a separate room pulled out for a day. So they emptied a storage closet. They got me a substitute teacher for a whole day. Well, it was like 3/4 of a day. And they let me and the school psychologist go in there with this student and do an FA. And during that time, I wrote to Brian Iwata because, it says address correspondence too. And I didn't know, I was like, whoa. So I'm asking him all these questions. But I was like, well, but what if, they're alone in the room and they're just bored. So that's why they're engaging in the behavior. And he's like, yeah.
Yep. Exactly.
He was incredibly patient with me, answering those questions. And I was just like the substitute teacher out of Delaware. So, yeah. And so we figured out the function was attention. We developed an intervention and it halted this process that we had started in which we were on a trajectory to a punishment procedure. So we were sort of collecting the data that we were going to need to go to the district to justify an exclusion timeout, And we didn't have to do that because we taught him to use a look at me request. And we did some other things and knowing the function of his behavior allowed us to avoid a restrictive placement, a restrictive procedure, and made the whole classroom a less restrictive placement for all the students because we got to go back till recess.
Nice.
Yeah,
that's powerful. Yeah.
Yeah. And so then when I got to graduate school, first of all, I was like, okay, I got to drop everything and learn about this. Right.
Right.
And I got to go work with this guy who knows about this stuff. And that's how I ended up at Florida. And when I came across the Sigafus and Sagers paper in a course, I was just like, I couldn't sleep. I was so excited because I was like, this is something I could have done. I could have used in my classroom.
Yeah.
And it was like I was saving an earlier version of myself from heartache, and preventing that for like that same kind of heartache for other people. And I think a lot of times we come to this work with concern for students, children and families. And I have that too. But I also came to it with this sort of compassion and understanding for the pressures of the teachers, and
yeah, for sure.
That's why I've, allocated so much responding in this area.
Hey everyone, it's Zach again. If you're interested in getting CEs for listening to this episode, the second code word is work. Like you're driving your car on your way home from work. Work. W-O-R-K. Work.
Sarah, I think your example is a great example of the length that you can go to make a functional analysis happen. If you know what I mean? Like, because anybody who's worked in a school, especially maybe a public school, like that's not easy to obviously, you mentioned that there was a substitute, so you could go run these sessions. Like that's like,
it's a big
hard
deal
to come by. Yeah, it's a big deal. I think like obviously there's other methods of functional assessment, right? So there are things like QABFs, ABC data, which I think in my experience, especially in maybe public school settings or other settings, those are more of the typical or more popular methods of functional assessment. What are your thoughts on that? And think about like ethics. What are the ethics around, choosing maybe one of those methods over the use of a functional analysis as you just described?
Mm-hmm. Well, first of all, I want to point out that I always start with an indirect method. I use the FAST, but I don't limit myself to the questions that are on the paper. But what I use the FAST for is as a screening tool. So I sit down and I...
you mean the ST?
Yes.
The ST part of FAST? You
Yeah.
use it the right way.
Right.
Oh, okay. I see.
Functional analysis screening tool. Right? So yeah, I use the FAST, and I use it as just a jumping off point for conversations with the families about, or whoever I'm talking to, about the child's problem behavior. And I have specific goals in mind. So the first thing I want to do is learn about the topography of the behavior. How severe is it? How dangerous is it? Am I going to need protective equipment? What do I need the therapists to be able to be prepared for in terms of their own safety and the safety of the person that we're doing the FA with? I need to know if it's so severe that I can't even target the problem behavior, that I have to do a precursor FA, or maybe I have to limit the occurrences. And so I'm going to use something that allows you to identify the function with fewer incidents of problem behavior, like a latency FA, or in some cases a trial-based FA. I need to know, what do people do when the child engages in problem behavior? So there's a question like that on the FAST, and they'll say, oh, well, I reprimand them. And I say, okay, well, I'm your child. I'm doing the thing. What do you say to me when you reprimand me? And then I make a note of that, so that that's at least one of the types of attention we deliver contingently in the attention condition. What kinds of demands are present when the problem behavior is occurring? Oh, it's like the handwriting worksheets. Can we get a copy of those? So I'm tailoring the features of my procedures to match, to the best of my ability, what controlling variables are in the environment, knowing that not all attention works the same way. Not all demands are equally aversive. If somebody says, okay, well, it happens when we ask them to do things, but it only happens in the cafeteria. Okay, so is it if I suspect that it's the volume in the cafeteria that's influencing the aversiveness of the demands, then I'm going to consider that when I design the escape condition. So I use that as a conversation to get as much information as I can. I don't even tally up the percentages because I know that the research does not support the use of indirect methods to identify the function of behavior. There's a really good exception to this. Rick Smith and some of his students did a paper where they did an indirect assessment with, I think it was 5 or 6 informants across multiple settings. And if they had agreement with all of those or most of those individuals regarding what the potential, that they thought the function was, that was more likely to correspond to an FA than if you just have, the teacher and the paraprofessional are both talking about the child's problem behavior all day, have already come to the same conclusion about it, and are both just reporting that in the form of an indirect form. Yeah.
And everyone's always trying to reverse engineer it anyway. So they're like, oh, this is the attention question, right? Yeah.
Yeah,
it's high. Yeah.
We're like, well, not exactly if you word it that way, but let me explain why,
Yeah, right.
And then, different environments might have different cultures about their beliefs regarding behavioral function. Like some schools that I've walked into, it's there's this widespread belief that, everybody's just doing it to get out of work. And so you have to sort of cut through that to find out why this particular kid is doing it, or in that environment, they are looking for attention. So, ABC data that's tricky because I really think that descriptive analyses are an incredibly useful and undervalued tool in our field. But I don't think that they are considered for the reasons that were intended by Bijou. Like people cite the Bijou paper, like, oh, we did this descriptive analysis to determine the function of behavior. That tells me that they haven't read the Bijou paper. They just read the abstract, because Bijou says in like 2 different places in the paper, don't use this to try to identify the function. You need an experimental analysis in order to do that. And the descriptive analysis can show us so much about what the natural contingencies are in that environment, what levels of reinforcement are maintaining behavior, So for example, if you know that a child's behavior is maintained by attention because you showed that in an FA, you can then go back to that classroom and see, okay, so, 1 out of every 10 instances of problem behavior is followed by attention. That is on a very, very lean schedule of reinforcement, and it's maintaining. And so that teaches me something about what my intervention is going to have to look like in order to be successful and sustainable long term. So I love DAs for the purposes for which they were designed, but using them to determine the function ignores everything that we've learned about intermittent reinforcement, programmed contingencies in the environment, versus actual contingencies that are maintaining behavior. It just dishonors all that work,
Very
Could
good.
you imagine a situation where you would base an intervention based off of indirect and descriptive data alone?
Yeah. Because sometimes, you're it's like a rock in a hard place, and you, for whatever reason, you're not allowed to do a functional analysis in that environment, or you're dealing with really, really low frequency, high stakes kinds of behavior. You've maybe made an attempt towards doing an FA, but you can't get it to happen. And maybe, it's like one of these situations where you're flown in to like figure out what's going on fast and develop an intervention. And you want to spend more of your time building that robust intervention, but it's risky when you do that. It's a gamble, because at the end of that, if it works, great, yay, we won, if it doesn't work, you don't know if you got the quality of the reinforcer wrong, if treatment integrity isn't what it's supposed to be, if it was multiply controlled, then you missed something important. You just don't know what the issue is. And my fear is that at that stage, it's really hard to go back and say, well, we don't actually know what the function is. And they're like, well, why did you train us all to do this intervention if you didn't think it was going to work, And so it's a gamble.
That makes sense. I can definitely relate to that.
But the number of times that I've personally felt like I was in that situation are not as high as somebody who is not in a university setting, would encounter. Like, I have the luxury in a university setting of really determining what the function is most of the time,
Mm-hmm.
And I respect that difference, that's not always the situation. But that's why I've, worked so hard on modifications rather than just running around and saying, well, everybody has to do this, And I really don't think anybody, I hope nobody's doing that. Like, Brian spent a lot of his career working on adaptations or encouraging his students to work on adaptations to make, a robust technology is only as powerful as it is accessible, So it's gotta
Yeah,
it's gotta be accessible to people. It's gotta be within, their means. Sometimes people would say to me, well, I can't do, especially like when I moved to Utah. I moved out to Utah and people were not doing functional analysis for the most part, with some exceptions. And they said, well, we don't have this clinic space with all these different rooms with, the windows that look like mirrors from one side, but windows on the other side. And, the rooms aren't painted different colors, and we don't have all these things, and we don't have like nursing on staff and all of that stuff. And I said, yeah, I never have either, I never did either. I went to University of Florida and sure enough, had Brian Iwata as my advisor and definitely never had access to a facility like that. And yet we were able to get powerful control over behavior using functional analysis in, every case I was involved in for the 5 years I was there.
Are there times that you feel that it could be unethical to use functional analysis? I'm going to leave this long thinking period into the podcast.
Yeah, leave this long thinking pause.
I like it. It shows that it's not an immediate answer.
Well, I mean, it's tricky. It's here. I'm going to answer by describing something that I find that I encounter, when I'm at conferences. People are talking to me after presentations. And that is that, somebody will say, and I see myself in that situation, like, I didn't try an FA on a like really easy, straightforward case. I tried it on this like really complicated case, at least for me. It was very complicated for me at my skill level at that time. And sometimes when you sort of save the FA for the hardest case and you aren't adequately prepared, then it's maybe not ideal. I'm not going to say it's unethical, but it's not necessarily ideal. My recommendation is that you do it for the first time when you're pretty darn sure you know what the function is already. Or when the behavior is really not all that severe. Just sort of figure out how to do it, like otherwise it's the equivalent of like throwing somebody in the deep end, and that doesn't really make a lot of sense to me. I would start off just like we do with all of our other skills, with supported experiences that are designed to contact contingencies of reinforcement, just like any other skill.
But practice it.
Practice it. Yeah, get some feedback on your performance.
Good.
So I'm gonna ask the other direction with that question. Is there a time where you think it's unethical to not do a functional analysis?
Yes.
That was short latency, that one. Yeah. That was short latency. Strong response there.
And that is when you're going to be doing an intervention that if it doesn't work, you're going to punishment.
Okay.
So
you're saying before you go the punishment route, definitely you better know what's up.
Yeah.
Okay.
Nice. That's great. That's actually something I'd never thought about before, and I'm really glad you brought it up.
There was a book. It's an edited book. I think the editor is Singh, and Brian Iwata has a chapter in it where they discuss. It's on the use of aversives in behavior analysis, and it talks about how the purpose of the functional analysis is really to avoid the use of aversives, or one of the purposes, is to avoid the use of aversives. Because if you don't know what the function is and then your intervention doesn't work, then you're likely going to at least use some kind of aversive procedure.
That's a good point.
Very good. Yeah.
And that I also want to point out that I think it's really important to know specifically, as specifically as we can get, what the function of problem behavior is, because on the other side of all this is the intervention. I try to think, like, when I'm asking myself a question, be it scientific or behavioral, well, that's the same thing.
Oh, nice. She set that one up. Behavioral scientific behavioral equals scientific. For anyone listening, she had that written down.
That the end goal is a happy family, classroom, group home, whatever, right. Where people are empowered by an effective intervention to have, make life better, more positive interactions. Everybody's, that's what I'm trying to get to. Right. And so right. It's not like, okay, I know what the function is. Bye-bye. We're thinking about what this is going to look like long-term. So I'm looking for interventions that are as simple as they can be, as clean as they can be, because those are easier to teach. Things that can be adapted to meet specific needs. Like, okay, it's awesome that you figured out that the kid wants attention, and now they can ask for attention. But guess what? Attention's not always available. There's a Hanley-Iwata Thompson paper on signal availability of reinforcement that is like my favorite paper. And, the data from the paper, it's a beautiful, beautiful paper. And it's a lot easier to set up these more complex things if like you've made other things simple, so I can use SD and S delta to signal availability of when reinforcement is going to happen. If you engage in this response, easier if I've got it narrowed down to only those elements that are related to problem behavior. And then you can think about that as an experience for the child, for the person, for whoever, to use appropriate communication to get what they need and know when it's available, know when it's not available, and then see that generalized to other kinds of mans in their environment, And that's really a nice thing.
Yeah, I used to say something like, all right, so we got the function, but that's only half of the problem.
Or a quarter of the problem,
Yeah, and now over the time I've been like stepping that back, and it's like, actually, it's like we're like 10% there, guys. Because that's exactly right. Like the function is almost the easy part. And then it's like, how are you going to make an intervention that actually works for everyone and actually works? So
that people will use,
right.
And not just like, oh, thank you, please get out of my house now, so I can lament about how this didn't work, just like everything else that people have tried to get me to do.
Yeah, right.
You got to ground this in the real world. And I think maybe it's only 10% or 25% or whatever percentage of the problem, but it's the foundational layer here. It's like, what do you want to build your house on? Sand or rock?
Yeah.
Because otherwise, all the bells and whistles, none of that matters.
Oh yeah, Caleb, by the way, QABF equals sand. That's what she's saying.
Oh gosh. Oh, I didn't say that. You said that.
Oh,
who said that?
I don't know.
Who said that?
Maybe Caleb said it.
Yeah.
Caleb said it.
I'll just be the scapegoat of this episode.
Perfect. I'm editing it, so I can make you look. Yeah. Okay. Very good.
Oh, can I say one more thing about descriptive analysis?
Yeah, you can say two more things if you want.
Okay, cool. So I remember we had this kid, and he had this, like, I'm showing my hand. You can't actually see my hand because
that's right.
This is audio, but he had like really serious tissue damage on his hand between his forefinger and his thumb, from like long-term biting and, really just making a mess of his hand. And it had all healed. It was, no active problem behavior was occurring, right? So you might ask, well, why were we called in? Because there was also no progress on any educational goals because that child had effectively trained everyone in his environment to not ask him to do anything he did not want to do, so we hadn't had problem behavior in a real long time, and he also hadn't done anything, and so you could have done a descriptive analysis in that classroom for a really long time, never have seen the relationship between the controlling variables and his problem behavior. Did that mean that function didn't exist? That function totally existed, but he had changed the program contingencies in his environment to match his needs.
Yeah, that's a good point.
Yeah, that's very interesting. Mm-hmm.
So I have a question. What would you tell somebody if let's say you have a BCBA that never has conducted a functional analysis on their own? I think people when they're getting supervision and when they're going through their coursework, I think that there's, some variability in the amount of experience and training people get in functional analysis. So let's say you're a BCBA, you don't necessarily have a lot of peers around you to give you training on that. What would you say to them to maybe encourage them to use functional analysis either for the first time or to start trying to implement it more as part of their FBA process? Because like I mentioned before, I think oftentimes, in practice, indirect assessment and descriptive assessment kind of primarily is how we're doing our functional assessments.
Yeah, no, absolutely. Well, first of all, I'd ask them a question. Like, have you ever conducted a baseline? Because if you feel comfortable conducting a baseline in which, you're reinforcing problem behavior, then a functional analysis is really it's an NCR condition and it's a few different potential baselines. If the baseline's not relevant, if that controlling variable isn't relevant, it's going to be pretty chill, If it is relevant, then it's just going to look like baseline for your intervention. It's also important that we consider this problem from a behavioral perspective. What we want to do is we want to, as a field, I think, make adjustments as needed. So if we need to make it easier to do an FA, if it's the more effortful response, then we find other approaches, other modifications that make it work better, or if we want it to be more reinforcing to do so, maybe we create networks of professional learning communities, or encourage people to attend workshops, or where they can get some hands-on practice. Maybe they seek out consultation, like it says in our code, to work with somebody to get their feet wet in this area, to build up that confidence, so they can get some practice under their belts before they move on to working independently and feeling more confident while they do so.
All right, so we're back to talk about the interviews that we just had with Dr. Bloom and Dr. Kahng. Pretty good stuff, pretty excellent stuff.
Yeah, big thank you to them. That was excellent. I'll say it exceeded my expectations.
Yeah, I'm kind of with you on that. I had high expectations just because I know that they're both very accomplished clinicians and researchers on the topic. But yeah, they were really good, and I agree. I think that they were above what I expected.
Yeah, and so anyway, thank you to them. I think one of the things that I couldn't help but take away was that when I hear our first conversation again, because I listened to it and I was like, I think I'm a different person now, Caleb.
we're changed forever.
I think so, because in some sense, it was really quite. I found it to be quite inspiring. My wife was listening to it, to the interviews as well, and she was saying that she had this sense that it was a lot like going to a conference, and when you leave a conference, you often feel like inspired and you feel invigorated again, and so she had that kind of same reaction, which is like, I need to get in there and do more FAs. I need to be creative and come up with modifications that'll work for whoever I'm working with. And I felt the same way. And I thought that was a good analogy.
Yeah, for sure. I mean, I think definitely after having those conversations, there's plenty of things that I can do to improve my assessment process for sure.
Yeah. I think that probably both you and I use more FAs than the field in general, like if you were to take an average. But I think we still should do better. We should still do more. When we think back to the Roscoe study, where it was something like 70-ish% of people thought the FAs were the gold standard for FBA, but only 35%. So basically half of those people actually use functional analysis. It seems like we should strive to do better than that, I think, in our field.
Yeah, I mean, I think it's obviously like we want to constantly be improving, or at least that's the way I think about it, right? Like we want the field to be improving, so hopefully those numbers will be going up. Like, so if they redid that survey after a number of years, hopefully more than 70% of people would think it's an important part, and hopefully more than 30 some odd percent of people are incorporating FAs into their regular practice. So I think it's, in some ways, it's encouraging, because I think that it's exciting to think of ways that we can better serve our clients.
Yeah. Actually, who's going to do the survey? We got to get that survey again. That would be great. That's a great idea.
Right. It's like every 5 years, same survey goes out.
Yep.
What was take home point number one from that conversation? It was that an FA really should probably be part of most of the functional assessments of problem behavior that we're doing.
Yeah.
Like that's the big take home, right?
Yeah, sure.
That was the first question we asked each of them, and they had pretty quick responses to, yep, that's probably a good idea to have an FA part of your assessment.
Yep. And I think both of them were very, open and honest about how reasonable it can be to conduct an FBA without a functional analysis. But they were hesitant to say that that's, just because it's reasonable to do so, maybe it's doesn't mean it's like the best thing you should do. So I know that after that conversation, I'll be really striving to do more of them. Just a higher percentage of my cases will have a FA as part of the FBA. And I think Dr. Kahng, when he got into that, he talked about essentially the right to effective treatment, right? And so FA is, because it's the best practice, it's, the gold standard, and our clients have a right to that. Yeah,
exactly. So if you're going to think of what he described as state-of-the-art technology, right? So we have different assessment methods.
Yeah, state-of-the-art. That's right.
If you're maybe not using functional analysis, you're not probably using the most effective or the most state-of-the-art technology our field has to figure out what the function of behavior is.
Right. Yeah.
So ethically, this seems like something we should consider, right? Because same way clients have the right, like you said, to effective treatment, they also have the right to effective assessment methods.
Right. Yeah. I thought that was a great point. Yeah. We ended up talking to both guests about whether it's ever unethical to do an FA. I think they did have examples of those, but, Dr. Kahng really focused on how a lot of this can, these questions about whether it's unethical to do an FA, some of them just might be fictions.
Right. Like there aren't actually many data to support some of the reasons why people don't do a functional analysis, like the safety. Do you remember when we talked about safety?
Yeah. Yep. I thought that was a great point too, because he was like, yeah, well, if we think about safety, let's think about how many people are usually with that person. Maybe they're in a classroom and it's like a 1 to 5 staff to students or something. And then in an FA, you got like 3 people like ready to respond. Everybody's geared up. They've already put their safety procedures in. There's protective equipment, and you're in a controlled environment. So how is that less safe than the natural environment?
Oh, right. He also talked about schedules of reinforcement. So
That's right.
In an FA, usually you have the continuous schedule of reinforcement, which can actually result in a lower response rate than possibly the natural environment that might have some sort of variable schedule of reinforcement, which he pointed out, like, as we know, like variable schedules of reinforcement can produce more behavior, which that's probably not the safest thing to have a bunch of problem.
Yeah, and I think that's right. And both of us have come across situations where you put in an FR1 schedule for problem behavior, and the behavior gets very efficient and not really a safety concern after a few examples of it, of meeting a contingency like the first time. People start to kind of get a little bit lazy with the problem behavior, which is exactly what you want them to do.
Yeah. So overall, take-home point from that is it's not usually going to be unethical to do a functional analysis. I think one thing that Sarah brought up, which is an important consideration, is that you do need proper training to do a functional analysis, right? So we're talking about like, oh, generally you should do it because that's the ethical thing to do, but that also requires training to be able to do it correctly and in a safe way, right?
Yeah. So I think she was saying like, I don't think she said it was unethical. I think she just said, we should really be cautious about never having done an FA before, and you decide that you're just going to choose the most complicated and most dangerous behavior to run your first FA, and then you jump in with nobody to support you. That could lend itself to kind of a dangerous, if not unethical situation. And I thought that was a good point.
Yeah, I think she used the example like jumping in the deep end.
Yeah, right. Yep.
Right? Like maybe if you're doing an FA for the first time, you should pick something that's going to be basically a layup, right? Like something that you already kind of know what the function is. And then it's really just kind of demonstrating, like validating something that's seems rather obvious.
Yeah,
so that way you kind of get your feet wet.
Yeah,
get your feet wet. Don't just dive in.
Yeah, that's right. Yep. And we'll talk, I think, a little bit more of that at the end here. But that was a pretty good example. And there are the cases where you have to take special precautions, but just because you're taking special precautions doesn't mean it's like unethical to do it. You and I have done things like this before. We have things that have been published over the last 20 years that allow us to do some, we can make modifications. So we see less problem behavior in the sessions, right? Maybe we could do a latency-based FA. So you get that one example of problem behavior per session, or you could do a trial-based FA, or you could do a precursor FA, or, there are modifications that will help us to alleviate some of these concerns we might have about safety.
Yeah, for sure. People have definitely done a lot of work in that area to overcome that barrier, for sure.
Yep.
So that's the ethics behind why you might not do a functional analysis.
Right.
All right. So another question that we asked was if it would ever be unethical to not do an FA. So maybe you do like some other forms of functional assessment and you forego the functional analysis. And they both were pretty clear that that can definitely be the case.
Yeah, I almost got the sense from SungWoo that often that would be the case. I think his position was like, it's kind of unethical not to use a functional analysis. And he set it up with the example of right to effective treatment and assessment.
Yep, for sure. Yeah, and then Dr. Bloom had a very similar sort of response to that, right?
Yeah, so it was similar in the sense that she agreed that there are times that it's probably unethical not to use a functional analysis. But I really liked her stories that she told. One of the things that really made that interview fun and interesting was the examples she gave. Like, I thought she had some great examples.
Yeah, her sort of like story about her struggles as a teacher in a public school, trying to figure out what was going on, and emailing or contacting Dr. Iwata to figure out how to do an FA, and just like, very interesting, very compelling story.
So her example, though, was that she believes that FA is like a safeguard against the use of punishment.
Yeah, I love that point. So yeah, it could be unethical to not do an FA and then go ahead and implement a punishment procedure.
Yeah, right. Yeah, so she made the argument that essentially it's unethical to use a punishment procedure if you don't know the function.
Right. So the way I kind of would think about that, right, is the whole idea of function-based treatment is to hopefully avoid using aversive procedures, right? Like, if you know the function, you can do some alternative behavior that's functionally equivalent. But the reason why an FA would be required is just because we know the limitations of the other functional assessment methods, right? So just because if you develop a treatment based on those other methods and your treatment's not working, what we know about those methods, it might be kind of likely that it's just not the right function, right?
Yeah, right. Yeah, just got it wrong.
So rather than being like, oh, I think we need punishment to make this function-based treatment work, it just might not be a function-based treatment because maybe you thought it was attention based on the results of an assessment. Maybe it's not. And so it wouldn't justify the use of punishment versus if you got a clear functional analysis that shows what the function is, and then you still need the use of punishment, that would be, I guess, more ethically acceptable.
Yeah, that's right. Yep. And so, so when if you get the function wrong, then you are left with this situation where you're not sure. Like, you could wonder, is procedural integrity a problem, or is there something about the treatment that's just like not very good? So if you had the function right, then those are the things you think about. If you're not really even sure about the function, you have to go back to the beginning. You have to say, well, do I even have the function right, let alone the treatment, and let alone the treatment integrity, right?
Right, and that's where things got biblical, where to build your house.
That's right. Yes.
On the solid rock or on the sand.
Right. Yes, right. I think the most important part of this episode really was when we asked the kind of final question, which was about what do people do if they don't have good training, or maybe no training at all in conducting functional analysis. But now we've put this kind of ethical burden on them that they must now feel this obligation to do more functional analyses. So I thought that was a very important section, and I loved the answers from both guests.
Right, yeah, because that is probably like one of the major barriers, right?
Absolutely.
Like if people just aren't comfortable running the assessment. So one thing was Dr. Kahng said you can reach out to somebody, to maybe like an institution, maybe like a school or a hospital or some place that routinely uses functional analysis.
Yeah.
A colleague. And see if you can observe and like learn from watching other people do it.
Yeah. Yep. So you get kind of, you can get involved in the research. You can find a study that you want to try to replicate, kind of, right? You find your latency-based FA, you find your trial-based functional analysis, you find, we'll go look up a Sarah Bloom study, right? And you're like, I want to do what she did because I have a similar experience to what she had. She was a special education teacher and she just wanted to learn it. And so she did it. And so you look up the paper, you figure out, and then you figure out how to do it. And then you go find someone who you can watch do something like that. That'll really help a lot.
Yeah. And I forget who mentioned this, but they also brought up workshops, right? So like conferences and stuff like that, they might have a workshop on functional analysis. I feel like Dr. Greg Hanley probably does workshops with the ISCA.
Exactly.
Like I think there's just like if you want to learn about functional analysis, there's certainly ways to do it.
Yeah,
for sure.
I went to a Dr. Iwata workshop. I've been doing functional analysis for several years, but I went because I was just like, I wanted to sharpen my skill set, and it was great. Like, I thought it was really well done. I don't know if he's doing them anymore, but certainly there are people in the field that are doing workshops for people, and that would be another great way to do it. Yeah.
Right. So you got like workshops, you can consult the literature, you can reach out to colleagues, you could possibly reach out to places that are routinely using functional analysis and see if you could use them as a resource, come in and observe
Caleb.
or something.
Yeah, he's gonna help. I'm just joking.
Yeah. Something that I know we've talked about before is people who do functional analysis love talking about functional analysis. That's right. We're examples of that. We do functional analysis, and you and I have just like talked about functional analysis forever.
Yeah, I mean, it's like,
because it's science. It's like experimentation and figuring stuff out.
Oftentimes when you see us talking about functional analysis, it's like two Bill Nye the Science guys just like excited about their experiment, you know? It's exciting. It's interesting to think about, and interesting to make modifications and try to analyze the data, and it's all fun. It really is. It's fun. So I want to bring up one more point that I thought Dr. Bloom mentioned that just was like really smart. And it was that oftentimes we get into a case and it's really complex and really complicated and really severe, and we decide we need to do an FA. And maybe that's not the best time to do your first FA, right? So like, I think her recommendation was like, do an FA when you already know the function or you're pretty sure about the function, and then get some practice when there's like low stakes.
Yeah, maybe like don't do it on severe self-injury. Maybe just do it like a young child that has like some minor tantrum behavior, something like that's just
do it on stereotypy.
Yeah, stereotypy. That's a good one.
Why not? I mean, it's like you'll get your practice. Stereotypy is easy because it's not something like stereotypy. I don't know, whatever you want to do, but it's something that's easy because it's not, you're probably not going to get this emotional behavior or these tantrums or this kind of destruction or anything, aggression. It's just, it's simple because you're going to deliver the consequences just as the protocol says, and you're going to spend the time just getting your feet wet and practicing. And that will set you up for when you have a more severe case and you feel like you need to do a functional analysis, you'll be confident that you can do it. I thought that was just a great point.
Yeah, for sure. One thing that I wanted to make sure that we talked about was the need for a manual in our field on conducting functional analysis. Dr. Kahng mentioned that, and it's actually kind of crazy that we don't have something like that.
Yeah.
Like that kind of resource.
Yeah, but what I really liked was that he thought that our listeners could be the one to solve that problem.
Yep. So anybody listening knows a lot about functional analysis should put a manual together.
Yeah, absolutely. I think it can be done. It should be done.
Because you can imagine somebody learning about functional analysis, somebody who's interested and wants to incorporate it more into their practice. That would be a great thing for them to get a hold of, in addition to all the other things we were talking about, like workshops and stuff like that. Like a resource that would kind of bring it all together.
How about this? Make the training manual and then do a workshop on the training manual.
Yeah, perfect.
Boom. Done. You're welcome, Dr. Kahng. The problem is solved.
Hey everyone, if you've been listening to this whole episode and you're interested in getting ethics CEs, the third code word is fitness. Like Caleb is into fitness. 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 When you finish this episode, head over to functionalrelationspodcast.com to purchase the 2 ethics CEs for this episode.
Great. Yeah, so to bring it all full circle, I think we've learned a lot about ethical implications for the use of functional analysis. I know personally, this has been helpful for me to think of ways that maybe I can improve what I do. And
I think that after hearing, Dr. Bloom, Dr. Kahng talk about this, I really hope that anyone listening can think about it as like, these are people too, right? They're publishing their research on this, but they're people. They have stories. Dr. Bloom's story about her being in this public school and really struggling to find answers to her problems are problems that we've all faced. So I hope that hearing them speak about it kind of creates an atmosphere that makes you feel confident that if they've been able to come from where they've come from and they're using it consistently, that you can probably do the same thing.
That's right. Functional analysis is the best technology our field has for identifying the function and ethically state of the art. And so I think we want to use the best we got when we think of the types of assessments and treatments that we're using.
Yeah, I think that's true. So I think that one thing that maybe, hopefully we can all agree on after listening was to say, it's probably best that we do more functional analyses, right?
Yep. So this has been great, Zach. I think I really enjoyed this episode. I thought our interviews were great. I'm just like really pumped to.
Yeah, I thought you did a good job too, Caleb.
Thanks, Zach.
You're welcome.
If you're interested in getting additional training in applied behavior analysis, it might be worth checking out both Rutgers and University of South Florida. Rutgers has a course sequence approved by the BACB. University of South Florida has a Master's of Science in Applied Behavior Analysis as well as a doctoral program in behavior analysis. Those are great places to study. Also, Dr. Bloom mentioned that she thought it would be a great opportunity to promote the Black Behavior Analysis group on Facebook. Check out the link we have in the show notes if you're interested in learning more about that.
So thanks, Caleb. And for those of you listening for CEs, remember, jump on functionalrelationspodcast.com. You can get those CEs. This episode's worth 2 CEs. And if anyone is interested in supporting our work here, you can jump on our Patreon page at patreon.com/functionalrelationspodcast and support us. That would be really useful and helpful for us. Thanks a lot, and we'll see you in 2 weeks.
Yeah.